So welcome. Have a look at this. Centered in the lumen at the moment is a lesion in the proximal esophagus. Scope right now sits about 1 centimeter cranial to the lesion, and we are at 25 centimeters from the incisors. Elderly patient, complaining of retrosternal pain. Actually some features of chronic stasis and potentially a motility disorder and a diverticulum south, so cranial of this. So let's talk about interpretation. So just in terms of our first impression, looking at this, it's nodular in the center, takes up about half the circumference of the esophagus. And more than that, I don't think we can easily tell here. It doesn't deform the lumen. I think that's very important. The lumen is, for me, not deformed here. Looking at the borders, it's not so easy in white light to see. I mean, you might be forgiven for thinking that it goes up here. It's much easier in virtual chrome endoscopy, which we'll come back to. But these are you can see something of the capillary and vascular pattern in high definition white light here. In terms of, maybe we can just go TXI. I don't know if that's possible. In terms of detection mode, I think that TXI, so we're on Olympus 1500's imaging platform here, and this mode is designed for detection. So you see the little diverticulum there, and as you pull back, we should see this lesion is easier to see, and I do think that it is. It very much stands out pink, okay, it also stands out in the white light image, but you can see why TXI might be useful, because you get that highlighting of the vessel pattern that you don't get with white light. Just go white light now, please. Then you see that it's standing out a lot more. Okay, so in terms of morphology, this is relatively, the edges of this are almost completely flat. So you might call them Paris to B, if we go around here. And then the center is a little bit more nodular. Not very nodular, not a large dominant nodule, but there certainly is nodularity to it. And the thing, of course, we're always interested in the squamous lesion, so this is a squamous cancer of the mid-esophagus, is the IPCL pattern. And so here, you can see some very nice different examples of IPCLs, intrapapillary capillary loops. So if we just have a look for some more normal ones, let's come back onto the normal. Here we see nicely lined up normal IPCLs, moving into certainly abnormal areas. So very nicely you can see the border here between what is normal and abnormal. At the 6 o'clock abnormal, in the middle of the image is the demarcation line, which we could maybe draw around for you if one of us was feeling excited enough to make a video of it. And north of that, so towards the 12 o'clock, definitely some and the caliber and the irregularity of those vessels. If you just take this image as one, you have some relatively spaced out, relatively high, large caliber, but not the most large caliber. And the loops are bridged, so you can see bridging of the different loops in the center here. And then what's potentially more interesting, so by the way, just to show you that you can trace around this thing very nicely with near focus. In this case, on the Olympus platform, you can trace around it. You can trace that demarcation line all the way around it. In terms of the regular-irregular score, then this is already regularly irregular from what we've seen. And then we just have to look into the central part. So you don't have so many vessels here. They're all of greater caliber, and there's one right in the center of the image right now, which is very large and dilated. I'm intentionally not using, because it's hard to remember as well, the classification system, because I don't think it's really necessary to make these diagnoses. You can see here also that in the center of the screen now, if I freeze it, you have very tortuous, very large caliber vessels which bridge multiple of the standard capillary loops. And around this area you also have some surface fibrin, which is for sure also a feature of early cancer. So you see that here kind of at the 8 o'clock of the image. Okay, so taken together, this is a likely superficially submucosal invasive with the potential for deep invasion, early squamous cancer of the mid-esophagus, which in the age of this patient with the associated comorbidity is certainly a target for endoscopic resection. We will apply a tunnel approach, tunnel under the most invasive part of the lesion, and we will attempt to characterize that, and if we are able to proceed past it to the bottom, we will perform ESD. Otherwise, we will make consideration of focal full thickness excision of the center. Thanks for watching.